What happened to that New Year's resolution you made back in late December or early January this year? You didn't stick to it, but that doesn't matter. It doesn't mean that you're too late. It doesn't mean that it's too late to make a change or do that thing that you promised yourself you would do back in January, but never got around to doing. Even if it didn't make it past February 1st, that doesn't mean you can't pick it up back again. Hi, I'm Dr. Hadiza Maralia Suleiman, your favorite holistic reconstructive surgeon, and welcome to this live stream, the last live stream of the year on the Medical Information Channel. In this final episode of the marathon series, Do You Really Need the Annual Physical Examination? I will be telling you 19 things you need to do for your health before the end of this year. And while you are here, don't forget to support this channel by buying us a coffee. Just click on the link at the end of the video. You are welcome once again. I will be telling you 16 things to do for your health before the end of this year. After you watch this live session, I also have a pinned goodie resource for you in my comment section where you'll see the updated list of all the medical investigations you need to do before the end of this year, or at least at the beginning of the next year. One link for my lovely ladies and the second for my great grand gentlemen. Click on the link and you'll see that you're going to go on a perfect path to your optimal health this year, the end of the year, and the next year. I also have something important for you today. Just keep on listening. I welcome your questions and your comments. Hi, I'm Dr. Hadiza Maralia Suleiman again, your favorite holistic reconstructive surgeon, and welcome to this live stream. I'm going to answer the question, do you really need to have the annual physical examination? I want to ensure that you, my lovely viewer, have a healthy start to the new year. And so in this live session, I'll be telling you 16 things you need to do for your health before the end of the year. Think of these last couple of days. Think of these last couple of days you have left in the year, as you have plenty of time before the finishing line, okay? Think of those days as plenty of days before the finishing line. And since it's later in the year, attempting to turn over a new leaf, think of it, won't feel as intense, or you won't feel as pressurized as you would have felt if you were trying to turn a new leaf at the beginning of the new year. You can even say that you're getting a head start or doing a trial run for the next year's resolution. If you don't feel like redoing your incomplete resolution, there are plenty of things to check off your list. Plenty of things to check off your wellness list. Wellness-wise, if you haven't done so already, we're talking some of those important medical appointments you've been putting off, that workout class you thought about doing but never signed up for, and using up those remaining vacation days, those very important vacation days. Number 1, schedule your annual checkup. Schedule your annual physical examination. While there have been reports in recent years that the annual physical examination might not be necessary for healthy people, the Centers for Disease Control and Prevention still say that regular checkups are important. So you can discuss with your doctor what screenings and tests you may need, any issues you've been experiencing, or any questions you might have. And if you haven't been in years, then it's very important to go and see your physician. It goes without saying that If you have a history of health problems or are experiencing symptoms, you should see your doctor no matter what. Postponing your annual physical examination is just making your health just a little or just a little worse. Okay? Just which reminds me, even I have not gone for my annual physical examination this year. I've been putting it off, but I plan to do so, if not at the end of this year, at least the first week of next year. Number two, get your screenings done. Early body screening can save your life. Screening checks your body for any illness, for any disease that could be underlying. You can have some diseases that don't give you any symptoms. They just may be lurking there in the background in your body. And if you don't go for your health screenings, you might never know. You never know. You might have some underlying essential hypertension in the background. You may be pre-diabetic. You just don't know. Maybe you have a family history of diabetes and you're tending towards diabetes because of so many factors, poor eating habits and the like. So get your health screenings done as early as possible, even if you don't have any untoward symptoms. I have some goodies for you, as I mentioned, a free resource for you outlining the best screening tests you need to do before the end of the year to start the new year afresh and healthy. Just click in the link in my pinned comment below this video. Number three, visit your gynecologist and your urologist. And your urologist or your urologist. Preferably visit your gynecologist if you're a woman, and then visit your urologist if you're a man. While you might not need to get a pap smear, ladies, every year, if your last test result came out negative, it's recommended that you should still schedule a well woman visit to get a pelvic and breast examination, among other things, of course. Plus, depending on your age and your risk level, you may be due for a mammogram or a breast ultrasound scan. Both your breasts will need a mammogram or a breast ultrasound scan, depending on your age. There are different age ranges in which either a mammogram or a bilateral breast ultrasound scan will be recommended for you. So this is the perfect time to ask your doctor questions about your sexual health and or other gynecological issues or concerns you might have for the ladies and for the men. You might have some sexual concerns as well. You might have some problems with your private parts. You might want to clarify why you're not peeing as easily as you were doing before, why your urine stream is so poor, it's not flowing as it should. Or you might have some questions about why your sexual performance is not as optimal as it should be. You may need to be investigated and you may need to be on medication. So please don't forget your visit to your gynecologist or your urologist. Number four, get your teeth checked. Get your teeth cleaned. You may have some ill-fitting dentures. How about that sensitive tooth that has been, has been terribly, painful in the past? How about those painful dentures? How about those loose dentures that you've been having and that you have not been taken care of, or your dentures that may have been loose? How about that? Get your dental screenings as soon as possible. If you have sensitive teeth, whenever you take cold water or hot water, you may be overdue for your dental checkup, your dental visits. I know that I'm overdue for my teeth cleaning. And so I plan to do that when I go for my health screenings at the end of the year, or at least, as I told you before, the first week of the new year. 5, review your medication. Your medication, you may have been on prescription medication. You may be on prescription medication. You may have some medications that some medication that you may have been taking, but you're actually not supposed to be taking that medication. Maybe you've been on some over-the-counter medication suggested to you by a friend or a family friend or a relation. You may not need to be on that medication. So review your medication with your physician, your family physician, whoever is your family doctor. This will make sure that this medication is still safe for you. All the possible side effects will be checked. And if there's any need to change or add to your medication, you it's important that you visit your physician and ask him or her whether your medication needs to be changed, added, reduced. Carry a book with you. Carry a book with questions for you. Carry a book with a list of medication you're currently on, the list of meds. Take it to your doctor, your family doctor, in your next visit. Write the answers as the doctor is answering your questions about the medication or about your health. Any questions that you might have that you're asking your doctor and he's answering them, write them down in your book. You may forget them. Any issues, any concerns, don't forget. Which reminds me, I need to tell a family friend of mine who's due for her annual physical examination to carry that book with her. To carry that book. She has a book. She actually has essential hypertension and she's on medication. She knows her medication offhand, although I'll still tell her to carry her medication to see the family physician. But she also has a book in which she's been recording her blood pressure measurements at least 3 times in a week, morning and evening, morning and evening, and morning and evening, so that your family physician will check the trend of your blood pressure. If the trend is doing well, it's within normal limits, they may not be a need to change the medication. However, if the trend is on the upper side, likewise, if you're a diabetic, every morning, ideally, you should be measuring your fasting blood sugar every morning and evening if you are on medication. And so you should have a book in which you are recording all these values, your fasting blood sugar values, and take it to your family physician for your annual medical physical. Okay? 6, get an eye examination. Get an ophthalmological examination. If you wear glasses like me or contacts, this is something you should do regularly. And if you have an existing eye condition or you have a high risk of developing one, for example, some people have a family history of glaucoma, and so they should get their eyes checked very regularly to avoid blindness. The frequency depends on your own personal situation and what your doctor recommends. The Mayo Clinic recommends getting a comprehensive eye examination every 5 to 10 years if you're healthy, have no symptoms or vision problems, and are in your 20s and in your 30s. However, you may need to get your ophthalmological examination even more frequent than that if you have other health or other eye issues. So remember, for some of those using glasses or have pre-existing eye disease, as I mentioned, like glaucoma, eye tests should be much more regular. And yes, I'm overdue for my eye test. Some people, if you have prescription eyeglasses for some eye conditions like astigmatism or, some short-sightedness, some long-sightedness, and you're using glasses. Some health professionals recommend having your eyes checked every 2 years. Some recommend it every 1.5 years. It's usually a range, but please get your eyes checked. I'm overdue for my test. I had my eyes checked, I think, about 2 years ago, and I'm due for maybe a prescription change, although I can see very clearly with these eyeglasses. My eye testing, the results of my eye testing may have changed. And so, yes, I'm going to go for my eye examinations. I recommend that you also go for your eye examinations. And let me know in the comment section what happened when you went for your annual physical examination. I would love to know what your doctor told you at your annual physical examination. I would love to know what the results of your tests were. Just share with me in the comment section. I would love, love, love to know if you did go or if you are going to go. No, if you did go for your annual physical examination, I want to know whether you've gone for your annual physical examination or are planning to go and what the outcome was. And so, what next? Have a dermatologist, have a skin doctor check your skin. It's a good idea to get a skin screening yearly, especially if you're at risk for skin cancers or have other skin conditions which may be harmless for now or harmless forever, hopefully, or if you have a family history of skin conditions. So really, it depends on your skin health history. If you have a family history of skin conditions, please and please get your skin checked regularly by your skin doctor, by your dermatologist. He or she may need to check the whole of your body. He or she may need to tell you to address, of course, in the presence of another health worker, or in the presence of a family relation, and just make sure that you don't have any suspicious skin lesions that may put you at risk of developing skin cancer. So please visit your dermatologist, especially if you have a family history of skin cancer. You may also have some benign moles, some benign, we call them, sometimes we call them birthmarks. They may be a dark patch on some part of your skin, on your face, or any other part of your body. And if it starts getting itchy, that birthmark starts getting bigger, or you suspect it's changing in some form, yes, you need to see your dermatologist. However, we don't want it to get to that stage. So just go for your skin check at your dermatologist. Number 9. I think we're at number 9. Go outside. Okay? Go outside. It's so much harder to get outside, I know, during the Hamatan season, during the winter months of November, all the way through March. If you live in a place that sees dusty and breezy, cold or freezing temperatures in the winter time, you know you'd rather be inside than trudging through that cold wind, or through that cold dusty wind, or that cold snow. So before the weather turns chilly, get out there, enjoy the fresh air, whether it's a hike, a walk around your neighborhood, or even just stepping outside of your home for just 5 minutes. Or you might be lucky, you might be living in an area where it's a bit warmer than other surrounding areas, or other surrounding states, or, countrysides. And so it may be very, very viable for you to go out for your fresh air, for your walk. Okay? It will just give you a fresh perspective on life, keep you healthier, keep your lungs healthier, keep your heart healthier. So please go outside. And then number 9, still part of movement and activity. Keep active and get moving. Who here swims? Do you swim? Let me know in the comment section. Just chat me up. Do you swim? Yes, I know what you're going to say. It's too cold to go out swimming, but some people have indoor swimming pools, yes. So if you have that indoor swimming pool, hey, keep active, get moving, okay? Regular exercising helps maintain your independence, because conditions like obesity will be avoided. You'll be so active, in your home, outside at work, you won't need any help. And so why not keep active? Get moving, even if it's not swimming. If you have an indoor swimming pool, as I mentioned before, yes, you should swim. Learn how to swim. I've promised myself I want to learn how to swim, and I intend to learn how to swim, because I'm already exercising, I'm already active, but it's also good to have another hobby which keeps you moving. You might have made a New Year's resolution, to be more active this year, but maybe life got in the way, and now you're more sedentary than that you would like to be. Don't worry about that. Just make a point to get out of your chair, get out of your sofa, move around, get out of your bed, move around the house, okay? A good exercise helps improve your strength and your stamina. Your mood and your energy also improve. Just do it. Getting started can be as easy as finding ways to get more steps in your day, like taking the stairs when you can, or getting a walk in at lunchtime during the work day. Okay, during your lunch break, just walk around when you eat, or if you're lucky and where you need to eat is a bit far away from your office or from where you work, maybe a 10-minute distance. Instead of sending someone to go and buy food for you, why not just walk down there, eat, and then walk back? You'll feel lighter when you walk. All right, so just do it. Just do it. Keeping active should be accompanied with eating healthy. However, remember, don't forget to get my don't get sick checklist that you downloaded in my last marathon live stream, Kick Flu in the Butt. If you get that checklist, then you will be sure to be on your way to excellent health. Now, number 10, rethink your workouts. Rethink those exercises. Maybe you said you would cut back on, you know, I'm sorry about that. If you haven't worked out because you haven't felt motivated, or if you feel like you're in an exercise rut, maybe it's time to think that exercise routine. Maybe it's time to rethink that exercise routine. I suggest choosing go-to workouts that are simple but effective. Hey, life is unpredictable, and setting aside an hour or more for workouts that require a commercial gym may just not be feasible for you particularly. So find workouts that you can do in a short amount of time. Why don't you? For example, workouts that you can perform in the comfort of your home with minimal equipment. You don't need to have a treadmill in your home. You'll be amazed at the amount of stuff you can do and the results you can achieve without ever stepping into a gym. For example, you may be in a home, or you may be you may live in an area, or you may have access to an area where you could walk around for, let's say, 30 minutes, 20 minutes every day, or at least 3 times in a week, but you don't take advantage of that space. So why not take advantage of it? Rethink your workout. Even if you don't have a treadmill in your home, you don't have a big bouncing ball to, do some exercises, you can take advantage of the compound in your home, the large compound around your home. Walk around every morning or every evening, or at least 3 times a week for 20 minutes at each time. And by rethinking this workout, by changing the kind of workout you do, by changing the kind of exercise you do every day, it will make you better. It will make you have it will make you have optimal health. You could even make it a habit to play football with your pals, maybe like 3 times in a week, or maybe if it's too much for you because of work and other responsibilities, you may make it a habit to play football with your pals, maybe every weekend, every Sunday. At the gym where I work out, at the end of this year, they're actually having a party, an end of year party. And that is also another perfect example of, working out. It's a perfect example of, changing your exercise routine. It may make it more exciting. And, probably there'll be a dance off. I'm going to miss that. So sorry about that. So sorry for myself, should I say. So it's a perfect time to rethink your workout. You can do different things at different times and not stick to just commercial gym workouts. How about number 11? Kick that bad habit. Bad habit, you might ask? Maybe you said you would cut back on drinking alcohol. Maybe you said you'd cut back on smoking. Maybe you said that you'd quit smoking, or maybe you said that you'd quit eating, snacks, fatty snacks, those donuts, those meat pies, those cakes. Whatever you want to change, work on it now. For example, snacking also on biscuits and sodas or soft drinks in between your meals. So I advise you to please cut down on those bad habits. It will make you better in the new year. It will make your health better in the new year. How about number 12? What about journaling? Do you know journaling? By journaling, I mean that act of keeping a record of your personal thoughts, your feelings, your insights, and even more, even scheduling your activities, including keeping track of your to-do lists. It could be written down, it could be drawn, it could be typed. You could put it on a sticky note. You could stick it on your wardrobe, so that in the morning when you wake up, you see it. When you want to open your wardrobe, it could be a sticky note stuck on your mirror, so that when you go to your dressing mirror, your dressing table in the morning, you'd see that you have a note there. By journaling, as I said before, it's keeping a record of your thoughts, your personal thoughts, your feelings, your insights, keeping track of what you want to do in the day, during the week, during the month, next year, for the next 2 years. It could be written, drawn, or typed. You could illustrate it, in a stick form, in a stickman form, and it could be on paper, or it could be on your tablet. It could be on your phone. It can help you manage your mental health. Like like me, for example, I actually journal quite a lot. I do it on my phone. I have apps, like I use the iPhone Note app quite often for keeping track of my activities And so I journal. I journal my activities. I try to journal as much as possible. Also by keeping track of my, my activities, my plans. Even this live stream, I journaled it. I kept track of it. I made sure that it would happen before the end of the year. I was supposed to do this live stream last weekend, but something came up. And so by journaling, it helps make you keep track of your activities, and you'll make sure that you get them done before the time comes, and then you have other things take over your time. Okay, so please journal. I highly recommend it. You could even synchronize your apps that you use to journal. For example, I synchronize my note app on my iPhone with my MacBook Air, and so I'm able to keep track more easily whenever I'm on my devices. And then what else can you do? Number 13, use those leftover vacation days. We're almost at number 16. So going on a vacation can do wonders for your health. Do you know that a recent survey found that only 28% of Americans will use all of their vacation days? If you find that you have some extra days, why not take a weekend trip? Even if it's not your vacation days, you may supplement your vacation days with taking extra days, during your work week. Those weekends that probably we don't have much doing, why not take a weekend trip? Why not take a mental health day by, going on a mental detox? Just go somewhere for the weekend. You could check into a hotel. You could go to a family friend's house to spend the weekend. Just do something different from your normal work weekdays. And it can help manage your mental health in a fantastic way. Okay? And as I mentioned before, up to 28% of Americans don't use all of their vacation days. That's quite sad. So if you find that you have not taken any vacations this year, please, it's not too late to start taking your vacation this year. You could also plan, yes, a last minute big vacation if you've not taken your vacation this year. Plus, an opportunity. It's a great opportunity to do all those investigations, as I mentioned before, in the checklist. Okay, it's a great opportunity to go for your annual physical examination during your vacation. At least that is what I'm planning on doing. So I recommend it. How about number 14? Read those books. Read those books for your mental health, for your mental clarity, for great insights, for a sharper mind, for a greater mind. I have a book, I forgot to bring it here to show it to you. It's called The Productive Muslim book. It's fantastic. It helps, keep you focused day in, day out, monthly, weekly, your purpose in life. I'll show it to you at the next live stream. How about learning a new skill or a hobby? That is number 15. Learn a new skill or a hobby. Maybe you said you take up knitting, or you pledged to learn how to be a better cook, or you wanted to learn a new instrument. Maybe you wanted to learn how to play the violin. Just something different from the usual. If you haven't gotten around to it yet, now is the time to do that. It could even provide you with some much needed stress relief from everyday work life, everyday home life. And number 16, lastly, declutter. Yes, declutter. You must declutter before the end of the year. Before the end of the year. Cleaning out the clutter, clearing out the clutter, getting organized will make you more productive and can sometimes help you with that anxiety, with that stress. Get ready to welcome the new year by getting a head start on organization. Really, whatever you can do, whatever makes you feel good mentally, you should do it. By decluttering, I also mean decluttering that closet that has a lot of old clothes, a lot of worn out clothing that are supposed to be thrown out. The good clothing, you could donate it to some organizations that require, clothing for children, for adults. Some humanitarian organizations declutter, give away those old clothes. Even if they're not faded, just give them away. You probably have access to buying new clothing maybe new toys. Maybe your children's toys are too many and they're already grown up. They're not using those toys. Hey, give them away. Give them to someone else who will appreciate it much more than you, for example, or much more than your children. So please give away those old things. Clear out your room. Make sure your room has breathing space. Clear out your kitchen. Clear out your parlor. Clear out your children's room. Declutter. It will make your mind healthier, make your mind lighter, make you focus on other things, make you plan better for the new year, make you happier that you've given out old things to people who will use it and appreciate it much more than you or your family members. So, really, whatever you do, whatever you can do that will make you feel good mentally, whether it's meditating or whether it's even breathing exercises or even something else. If you have some other things that make you, that you know that you have an idea or that you know will make you mentally healthier for the new year, either mentally or physically, that I've not mentioned in this live stream, please let me know in the comment section. Let me know now. Let's chat live now before this stream ends because it's about to end. Let me know what you're planning for your good health, for your optimal health in the new year. And if you want to know the best screening tests you will need to do before the end of the year to start the new year fresh and healthy, just click on my links in my pinned comments below the video. Immediately after this video, I'm going to pin them. So medical tests, investigations for my beautiful ladies, for my great gentlemen. There are two separate links. Click on them. And while you're still there, don't forget to support the Medical Information channel by buying us a coffee, still in my pinned comment in the comment section. I can see some comments. I think, did someone say something? Oh, yes. Amina Suleiman says that as an elder, I say yes. Sorry about that. I just missed the message. As an elder, I say yes. All the advice the doctor has stated should be taken religiously. Live a more healthy life for your own good. Yes, Amina Suleiman. That's fantastic. I can see two people on the live stream. I'm welcoming more questions and comments. Ladies and gentlemen, do drop your comments and questions, and I look forward to our next live stream in the new year. And love you.